problem back again.
Dr. Samir, do you think that we should or should not trust the ads that we watch all the time on TV? You have a brand name that is a spray or a lotion or something that you put twice a daily or certain times per week, 3 times per week, and a shampoo that is named this way. These things, they have good results. Shall we trust them?
Actually, we have hundreds of thousands of lotions and potions for hair loss. Every day we hear about a new product. None of these lotions and potions is effective in treatment in treating the hair loss. As I said, in males we have propecia finasteride, these tablets, and minoxidil. In women we have minoxidil.
Yeah.
It might be, if it will not help, it might not give side effects. We can use different type of these potions or lotions, but actually they are not a treatment. International Society for Hair Research and Surgery and actually all the dermatologists, they know that we have only these 2 types of treatment again. Finasteride for males, minoxidil for males and females. We have laser therapy, as we said. It might be some doctors, they use this laser therapy.
You don't recommend it that much?
Actually, in my practice, I do not use it. I do not use it.
Something else I want to ask you about, Dr. Samir, as you're an expert in the hair problem. These days, we've been hearing a lot about the keratin therapy, and a lot of people, they are putting keratin upon their hair because they want it to be more shiny, and they want it to be lighter and straighter and all these things. But when I was surfing the net to know more about keratin, I found that it could cause hair loss, and it could cause baldness, and it's really bad and damaging for the hair rather than treatment. What can you tell us about keratin therapy?
Actually, I saw a lot of cases coming to us after using this keratin or different potions for strengthening the hair. These are chemicals. Chemicals, they might affect the hair follicles, and they might affect the scalp itself, the skin itself.
But the keratin is the substance what the hair is made of.
We have different type of keratins. Some of them, they are forbidden usually in most of the European countries and states. They are containing a lot of chemicals which causes damage for the skin and for the hair itself. I see a lot of cases coming with almost burned scalp, from using this different types of keratins. Actually, I don't know if I can recommend keratin or not. For some people it works, actually. I see
that's what I want to tell you.
Maybe it depends about the type of keratin that they are using. Usually we don't, as a physician, use keratin. In our practice, it's beauticians they are using.
Hairdressers they are using. So
I usually don't recommend.
You don't recommend that?
Each person, he has to be happy and satisfied with what
nature,
what God gives us.
True, true. What about the problem of losing hair going older? As you go older in age, you are going to lose hair. What can we do in this case? Take the treatment generally?
No, actually, as I said, in males, if we don't have androgenic alopecia, genetic problem, we might see receding only in hairline. And when we get older, over 50s or even over 70s, we see shedding of hair, thinning of hair, not losing of hair. The hair is changed. Consistency of hair changes from thick to thin hair. But we don't lose hair usually. Receding of hairline. With females, actually, due to menopause and starting hormone problems after 40s, we see shedding of hair. Sometimes we see hair, what we call it, epiphylism, that the hair is very thin, but it's sometimes all over the scalp. So hormone treatments, sometimes it might be helpful for them.
But also under the supervision of a dermatologist.
Yes, dermatologist of a
there should be a physician that we follow.
Yes, physician.
Yeah.
For sure.
I also want to ask you, Dr. Samir, about dyeing. Dyeing our hair, can it cause a hair loss?
Actually, now we have different types of dyes. Not like before. They start to put less chemicals. We have to avoid the dyes with ammonia. If they have a big amount of ammonia, we have to avoid these dyes. But in general, dyeing the hair doesn't cause hair loss.
Maybe that's why now when you dye your hair, you'll find the color is fading quickly because it's not as strong as before, but it's better for the hair. Some ladies put a lot of oils and serums on their hair so that it could be lighter or could look more better. And I've read that putting these things permanently is going to damage the hair as well. Oils and serums. Even if they are with good qualities.
No, actually, oils. It's good to put oils from some time to time with steam.
What kind of oils, Dr. Samir?
You know, I recommend usually olive oil.
On the hair or on the scalp?
Jarjir oil on the scalp.
On the scalp?
Yes, on the scalp.
Not on the hair.
To put it for 15 minutes to 20 minutes, not more. Some people, they put the oil and they sleep. They sleep all over the night. This might harm, not help, or might harm. Every 2 weeks.
Yeah, only oil, olive oil?
Olive oil from Jarjir, from almond. Oil.
We mix them together, or you mean I can put just olive oil on my scalp?
We can mix them, or we can put one by one.
For 15 minutes and then wash your hair?
15 minutes, yes, to 20 minutes.
On the scalp only, not the hair?
On the scalp, yes.
And what about serums?
Have different type of serums with vitamin A or some. Some people, they recommend, some doctors, even dermatologists, they recommend to put these serums. Some they pretend that it will regrow hair. Myself, I don't believe in these different types of serums. And there is new trend now, what we call mesotherapy. Mesotherapy is injecting vitamins into the scalp. To treat hair loss or baldness. Even some doctors, they pretend that it cures baldness. It makes the hair regrow. I don't also believe in mesotherapy. Some doctors, maybe I think if it will not help, it might not harm. Yes.
Yeah.
So
for hair transplantation,
for me, diet is more important. That we get vitamins, minerals, and everything through diet. If we have healthy diet, all these minerals and vitamins will go by bloodstream to the hair follicles. We don't inject vitamins from now and then.
But concerning hair transplantation, Dr. Samir, you're all the time with the surgery. This is the best way for solving the problem of hair loss. Hair transplantation through surgery.
Through surgery. Through surgery. This only hair transplantation we have through surgery. Actually, we have artificial hair. Hair transplantation by artificial hair. These are biofibers transplanted in the scalp. And this is very dangerous. It's not allowed in most of the European countries. In states also is prohibited. But we see it here in our countries, in Saudi Arabia, in Egypt, in Lebanon. A lot of even doctors, they are doing this, and we have a lot of side effects. People
you don't recommend that?
No, I don't recommend. I don't recommend this.
Yeah. Dr. Samir Abu-Ghouj, the plastic surgeon and the hair transplantation consultant, the spokesperson for the International Society for Hair Restoration Surgery in the Middle East. Thanks a lot for being here with us. You've told us actually lots of surprising things, and now we are more informative than before the episode. Thanks a lot, Dr. Samir.
Thank you for having me.
Thank you. God willing.